Hello, welcome to our group presentation. My name is Anastasia Darlene William, the group leader of this group. Our group chose the topic of how sleep deprivation can have an effect on mental cognition. It is an interesting topic to dive into. Now, let's look at an overview of how sleep deprivation can have an effect on mental cognition. For starters, according to Zurzursky, the amount of sleep we get coincides with our cognitive ability. To relate this issue to everyday situations, it is why when we are sleep deprived, we can hardly focus in class. Next, even a brief amount of sleep deprivation can have an impact on the learning and processing of new information, resulting in cognitive impairments, especially in the case of hippocampus-dependent memories, according to Bolsius. Last but not least, before we dive into why we chose this topic, which will be explained by Ms. Lee, sleep deprivation can lead to mental deterioration later in life. This is why we should prioritize and change our perception towards sleep as a sacred part of our health.
The goal of this study is to understand the relationship between sleep deprivation and mental cognition. We aim to emphasize on the symptoms and causes of inadequate sleep so it can help to increase awareness among those who are sleep deprived. The ignorance about the value of sleep is getting critical. Therefore, this study also highlights the importance of getting enough rest for maintaining the best health. Moreover, this study provides a clearer understanding of the effects of insufficient sleep on cognitive processes. It allows healthcare specialists to develop effective treatments and cures to decrease the impact. We found this study interesting because it gives valuable insight about human health and functionality. Sleep deprivation not only affects human cognitive function but also attention, decision-making, and mental health. Due to the strong connection of sleep with our overall well-being, this research is important in the field of cognitive neuroscience. Moreover, the negative effects of sleep deprivation on cognitive function have long been recognized. However, it is still unclear how it works and which cognitive domains are most affected. So, having a clear understanding of how sleep loss influences cognitive abilities can inform interventions and treatments for sleep disorders.
Next is about the methods on how to diagnose sleep deprivation. The first method would be polysomnography. It is a procedure that assesses how well we sleep, how our body reacts to sleep issues, and also detects the sleep issues. Basically, if the doctor suspects the patient having a more serious and potentially life-threatening sleep issue, such as sleep apnea, they will conduct a polysomnography. What does a polysomnography test do? It basically measures physiological factors such as brain activity, eye movement, muscle activity, heart rate, and breathing patterns. The most popular form of sleep study carried out captured brain waves and monitors your heart rate, breathing, and the oxygen level in your blood. This is an example of the figure showing a polysomnography test being carried out. As you can see, sensors are attached to different parts of the body for specific functions. For example, microphone records snoring and many more. The second method is called actigraphy, which most people are familiar about. It is a form of wearable sleep test that monitors your movements to assess when you are awake and asleep. It resembles wristwatches and are often worn on the wrist or the ankle. They have many essential components. It consists of an accelerometer that records movement, a data storage device, and a programmable timing mechanism. Actigraphic devices allow people to keep track of their own sleep patterns, which help them to eventually keep track of the duration of sleep that they need on a daily basis. These are figures showing examples of actigraphic devices, and the graph shown is an analysis or an actogram of a patient with disturbed sleep-wake pattern.
According to the Cleveland Clinic 2020, it is said that the most common symptom of sleep deprivation is first fatigue, and the second one would be microsleep. According to O'Connell in 2020, fatigue can be defined as an overall feeling of tiredness and lack of energy. It is a prevalent symptom in which individuals often experience the persistent feeling of tiredness and lack of energy throughout the day. Being sleep deprived can cause severe and persistent fatigue even after seemingly getting enough sleep. Individuals may feel constantly tired, exhausted, and have difficulty to stay awake during the day. This excessive fatigue can affect daily functioning, making it challenging to concentrate, perform tasks, and engage in activity that require alertness. Based on National Library of Medicine in 2016, the physiological repercussion of prolonged alertness and being awake at circadian time when the brain is geared to sleep has been reliably proven in the study. So what is microsleep? Well, according to Peters in 2022, microsleep is a brief involuntary period of sleep that can last ranging from a quarter of a second to 10 full seconds. These episodes of microsleep are prevalent when a sleepy person is attempting to resist sleep and stay awake. People who are experiencing microsleep have a tendency to blink frequently, have difficulty in terms of comprehending any type of information, yawn excessively, startle awake with quick bodily gesture. Microsleep can be detected on EEGs and is significantly linked to car accident, according to Center for Disease Control and Prevention (CDC) in 2020. I personally think that recognizing this symptom is very crucial to addressing sleep deprivation and prioritizing healthy sleep habits to promote optimal well-being. The symptoms become progressively worse as the sleep deprivation continues.
Sleep deprivation is becoming more common in today's culture. There are many effects of sleep deprivation on mental health. Sleep plays a crucial role in memory consolidation. However, sleep deprivation can greatly block this memory consolidation process, making it difficult to successfully store and recall knowledge. According to the researchers, they stated that sleep deprivation altered the hippocampus-dependent memory consolidation process, which caused a decrease in recently learned information retention. During sleep, the hippocampus replaces and strengthens the memories formed during wakefulness. Sleep deprivation disrupts this process, leading to a decrease in the hippocampus' ability to consolidate memories effectively. Consequently, sleep-deprived individuals may experience difficulties in retaining and recalling information as the memory consolidation process is impaired. Next, insufficient sleep also led to a lack of attention as well as a poor learning and concentration process. According to findings by Dawson and Ray, insufficient amount of sleep have also been shown to have a consequences comparable to drunkenness, which slow down thinking and response time. When we don't have enough sleep, our muscles are not relaxed, neurons are not firing effectively, and the organ system of the body are not aligned. All of this will cause lapses in attention, which will lead to accidents or harm to ourselves. Last but not least, sleep deprivation also can affect emotional regulation and mood disturbances. Lack of sleep compromises the functioning of the prefrontal cortex, which is responsible in emotional processing and regulation, leading to difficulties in managing and regulating emotions. There was a study that used fMRI to examine the neural correlates of emotional regulation in sleep-deprived individuals. The results reveal reduced activation in the prefrontal cortex during emotion regulation, thus indicating impaired emotional regulation abilities due to sleep deprivation. Lack of sufficient sleep affects the balance of neurotransmitter and hormones in the brain, contributing to changes in mood and emotional well-being, and also lead to depression, anxiety, and cause of the impulsive behavior.
Treatments and cures for sleep deprivation. Firstly, the doctor may advise their patients to use sleeping drugs, long-term use of sleeping tablets and other drugs, even those accessible over the counter, might impair the sleep. The only sleep drugs that should be used on a regular basis are those prescribed by healthcare professionals. We should only take them as directed. However, bear in mind that after a few weeks, they tend to operate less well. They have the potential to interrupt our sleep. A shift in a patient's body clock can sometimes induce sleeplessness. A circadian rhythm problem is what this is. The doctor may suggest undergoing light treatment for this. It can aid the resetting of the body internal clock, allowing the patient to sleep more soundly. If we are diagnosed with sleep apnea, the doctor may recommend using specific breathing equipment such as CPAP, that stands for continuous positive airway pressure, that provide a constant flow of air through mask in keeping our airways open. More one-off treatments for sleep deprivation is self-help initiatives. First, we can create a conducive environment to sleep. Make our bedroom sleep-friendly by keeping it dark, quiet, and at a reasonable temperature to reduce potential sleep disruptions. To filter out distracting sounds and lights, consider to wear earplugs, eye masks, or white noise devices. We can also customize our sleeping surrounding to meet our comfort needs, such as use finest mattress and pillow to provide ample support, and bedding to make us feel cozy while sleeping in a comfortable temperature. Secondly, engaging in relation practices before bed will prepare our mind and body to sleep. We can do the deep breathing techniques, meditation, stretching, reading, gradual muscular relaxation, or soaking in a warm bath. We should avoid eating a huge meal just before bed because it will make us feel sleepy. Napping may also help alleviate the symptoms of sleep deprivation. However, we should avoid napping more than 30 minutes since this may interfere our capacity to sleep. We should avoid ingesting coffee close to bedtime since this might interrupt the regular sleep cycle, diminishing overall sleep quality and also consistency. Lastly, we must limit our screen time before bed to allow our brain to relax. By spending our time around bright lights or using electronics before bedtime, it can disrupt our body's natural sleep-wake function. The blue light from the screens of gadgets can stimulate our brains and reduce our melatonin synthesis.
To sum up, our research and studies conducted on sleep demonstrate the direct impact it has on our life, both mentally and physically. Sleep deprivation alters brain networks, synapses, and neuronal membrane properties with negative repercussions for our health, careers, and society. Creating a sleep-friendly environment, practicing relaxation techniques, avoiding stimulants and devices before bed, and establishing regular sleep schedules can alleviate signs of sleep deprivation. Understanding the relationship between sleep loss and mental cognition emphasizes the positive effects on daily life and offers interventions to enhance cognitive function. In conclusion, by prioritizing sleep health, we can significantly improve cognitive function, productivity, and general well being. Let us recognize the importance of adequate sleep and make it a high priority in our lives. Together, we can pave the way for a healthier, more productive, and fulfilling future.